Dr. Woodward.
Thank you. I'm Amanda Woodward. I know I've been pointed out a couple of times, and you've heard about the caregiver study that we're working on. My goal here is to give you a little bit more detail about it and talk particularly about the phase that we're currently recruiting for. I'm on the faculty in the School of Social Work at Michigan State, and doing this in partnership with the foundation. So as you've heard a couple of times, this is a DoD-funded project. Just started September 1st, so very brand new. This is kind of the kickoff for our recruitment. It's a 4-year project. There are, well, I'll talk a little bit about why caregiver support. I feel as though I'm speaking to the choir here, so I won't say tons about it, but we know that caregiving is hard. We know that mesothelioma has unique characteristics to it. But there's also really limited research that just focuses on caregivers and mesothelioma. So as we were writing this grant, we found 4 studies that focused exclusively on caregiving and mesothelioma. There were other studies that looked at patients with caregivers enrolled, but it was still very focused on the patients. So we only found these 4 studies, and they were not in the U.S. They were in other countries, and of course we know the healthcare context and the social service context is different here. And then there's even fewer studies on the transition from sort of providing care to the death of a loved one and then moving into the bereavement. And so those were 2 pieces of information that sort of shaped the focus of this study. But also the Meso Foundation did this survey in 2021, and one of the things that came out of that was an interest, a need in different types of support for caregivers and the bereaved community, and that as being a place of improvement. So these things together are sort of what led to the current focus for this study. We're taking a community engaged approach. So you heard about the phase 1, 2, 3 for clinical trials. That was a nice segue for me, because there's also a parallel process through NIH for behavioral and psychosocial interventions called the STAGE model instead of phases. We have stages, and this is a stage 1 study. So it's parallel to a phase 1 study for drug trials and clinical trials, in that it's a developmental phase, focused less on safety and more on feasibility and acceptability. So what's the experience like for participants? Can we enroll people, and do they feel like it was worthwhile, and getting more participant feedback? We're taking a community engaged approach to the whole process of this study. So the research question and the focus, again, was sort of derived, at least in part, from needs identified by foundation community members. And then it's this partnership between MSU and the foundation, with our roles and responsibilities sort of divvied up by our strengths. So the foundation really helping with recruitment. They'll be providing oversight of the intervention when we get to that stage. MSU being the research arm, doing data collection, analysis, and then we're working together on sort of overall project management, dissemination, and communication of findings. And then the other community engaged approach of this is that we are really using community voices in order to help build, develop, structure the intervention. We have some ideas from research literature related to other types of cancer and caregiving, but we want to tailor this to mesothelioma. So there's 3 phases. Phase 1 is what we're in now, doing semi-structured interviews. I'm going to talk a little bit more about each of these. Phase 2, which we will do next year, is focus groups, and then in years 3 and 4, we'll do this feasibility study of the intervention that emerges from the first 2 phases. So phase 1 that we're recruiting for now, our goal here is to better understand the caregiver experience from the diagnosis of a loved one through the end of life and then beyond into bereavement. So we're kind of, at this point, defining caregiving broadly as current and former caregivers. And I'll talk a little bit more about that in a minute. We're doing in-depth interviews with 20 to 30 patients, caregivers, and bereaved. So we're focusing on the caregiving experience, but we want to interview patients because we want to get the patient perspective of the caregiving experience as well, in terms of the one being cared for and the observations of the patient, of what they see their kind of loved one dealing with, right? These are 1 to 1.5 hour interviews. They'll be by Zoom, and we do have gift cards for completion of the interviews. Phase 2, we're doing focus groups. We're going to take what we've learned in our phase 1 interviews and use that to develop an initial sort of rough draft of the intervention. And we're going to use the focus groups to get feedback on that, further refine the intervention, and including the types of outcomes we should be measuring. So what sorts of things would be important, like if you were going into this intervention, like what are the outcomes that you would want to see at the end? What do you think should be the goal? So what's going into the intervention, but also what should we be measuring in terms of outcomes? So this is, again, focus groups with patients, caregivers, bereaved, and then we'll also do focus groups with healthcare professionals as well to help us kind of put some of the community's experience in the healthcare context. And then the third phase, testing the feasibility and acceptability of the intervention. So we're using an intervention-only design, so no randomization at this stage. Again, as with this stage 1, the goal is to see, do people sign up? Do they have a good experience? And are there, as in the previous presentation, are there any signals that it is working that we justify then moving on to a pilot study? We'll do 3 of these online groups. There'll be 10 weeks each, at least that, unless we learn something different in the first 2 phases, with 10 participants each. And there will be pre and post data collection, measurement of outcomes, but also some more qualitative sort of questions around the experience and input and satisfaction type of measures. You've seen this a couple of times already. I thank you to those who have already completed the screening interview. So the screener asks some questions that help us sort of figure out who to enroll in this phase of the study. So if you complete the screener, does not necessarily guarantee that you'll be enrolled in this phase. We want to try and get as diverse a range as we can in the 20 to 30 folks that we'll be interviewing. But there is a question that, if you end up not being enrolled in phase 1, are you interested in the focus groups or phase 3, so that you can kind of keep your name in the pot so as we move forward. And I went through all of that pretty quick, but I'm happy to take questions.
Any questions for Dr. Woodward? And as before, Claudine and Maria are available if you would like to sign up for the study, have questions about it. There's flyers on the tables they're passing around, and the QR code is up there on the screen. So again, a round of applause for Dr. Woodward.
Thank you. Thank you for your time.